I'm going to try and speak quickly. There are a number of slides. I'll start. I think we have a picture of our former president. And this subject is going to be dementia, the way the brain ages. What can we do about it? And maybe at least an idea for neurosurgery. Maybe neurosurgery can do something. I'll start with the next. Now, this is a common, I guess, can you hear? You cannot hear? Yes? Can you hear now? Yes. Right. All right. Sorry. Well, this is a common event that takes place. Someone says, well, you're getting a little older, you must have Alzheimer's. And that's going to be a springboard, basically, to discuss some of the errors that take place as we assess causality. There's a little thing about the way that people sometimes say you have this particular disease, and I can relax about it, since that means if you have one disease, there must be one cure, and all we have to do is to find that cure and take care of it. So some of the ideas in the past, like lumbago, just meaning that you had pain in your back, well, there must be a cure for that, or sciatica, you've got pain in your leg, therefore we can cure it with one cause. But actually, there's a multitude of causes. Now, one of the things that happens in medicine and the medical arts is the idea of deductive reasoning. So what happens is that if there's one disease, we're going to fix it with one effort. There's going to be something would cure it. So if dementia is there, the idea is, well, there's one thing we can do to take care of it. And actually, it's a little more complicated than that. Some of this idea goes back to William of Ockham, who produced a cure in or at least an argument in the 13th century about in theology. Well, if there's a complicated world out there, the correct answer is the simplest answer, and his simplest answer was, well, God is doing all of this. So that sort of carries on from the point of view of looking at the world. And the idea is later, we've come up with the idea of multivariate analysis. In other words, many different things are going on, and how they interact with each other is quite an art form. And that's sort of how things have evolved. And they've gone into AI as well, which is going to give us, I think, a major insight into causality and understanding all the complexities. There's thousands of variables that are interacting in our life. Many. There's not a single variable that pretty much trumps them all. It's difficult to find that. Well, I'm talking about brain compromise. There are many things that are happening to your brain as you age. And this is sort of one picture of one of the things that can happen. This was some of my some work I did at NIH. And this is horseradish peroxidase that's in the capillary system. That's the brown substance. And then we can make it leak out with some tricks. And that's protein going into the parenchyma of the brain. And when it leaks out, it hurts the brain, if I could say that. And so one of the things that occurs on the inside the brain, there are these periocytes that are around the blood vessels, and they gobble up any substance that leaks into the brain. They try and do that. And actually, there's a comment earlier about what happens with vasculitis, getting substances that can constrict blood vessels. Well, this is one of the things that can happen. And in Alzheimer's, because there's protein floating around inside the parenchyma of the brain, these cells eat the protein up, and if they get too big, the amyloid will choke the vessel off. So that's maybe one of the things that's going along with the association of vasculitis and with Alzheimer's. Well, just a quick thing about what's going on in our brain. Many different etiologies are causing cell death, and it's unavoidable. So to say, if you're 80 years old, then your brain is something is going to be wrong with your brain, because all the cells are dying as you age. and there's nothing that can be done about it. You could even say is sort of a divine purpose that for you never to stay here as long as you'd like. Well, this is what happens with a number of neurons as you age. So they're dropping very substantially. And having said that, there are other factors that injure the brain as you age. So there's a variety of things happening to your brain unavoidably. There are many different things. There's just some of them listed here. Neurodegenerative disorders, vascular disorders, hydrocephalus disorders, infectious disease disorders, many things are hurting the brain. Now, what I really want to talk about is some of our ideas about one sort of missed etiology for brain dysfunction. And we maybe go a little bit into CSF circulation. That's what I'm going to talk about a little bit. So there are many different things that cerebrospinal fluid does. Number one, your brain floats on it. And one of the things that happens is that if you get a brain injury, particularly as you're older, the floating apparatus doesn't work as well. Also, the brain's mass is diminishing as you age. So I guess if my brain right now is, I'll make a joke, 2/3 the size when I was 21 or something. I don't know. It's dropping. Everybody's brain is diminishing in mass. And the buoyancy part of it is impacted, and the protection that you receive is also impacted. The fact that, and I'll speak more about this, the CSF it helps regulate autoregulation in the brain, the way that the brain metabolizes its nutrients. It also allows, there's a highway between cells in the brain. The cells are not just hanging out by themselves. There's an interconnection where nutrients of all types, all kinds of impact is going in the brain as this current, so-called bulk flow, takes CSF from place to place in the brain, and it's regulated by a number of factors. Well, now a really important purpose of CSF is to clear waste. So if you think about it, all those, how many billion nerve cells? Maybe about 10 billion of them. They all have metabolic requirements. They're working, they're doing something. And normally what you would imagine is there's a detritus that occurs as this metabolism takes place. And this detritus has to sort of be washed away if it's circulated out. And one of the things that goes on is the CSF circulation does that. So that's one of the good things. Now, this is an important point I'd like to make, is that many people, when they consider cerebrospinal fluid, they think, well, it's just there. It doesn't do anything. It's always the same. It's just there. We don't have to think about it. And the reason we don't think about it is we don't have any effective way to measure it. So this really should be considered like blood pressure. CSF circulation should be treated as if it's blood pressure. And the problem is that we don't have any effective way to look after it or manage it. So thus, we're really missing a major therapeutic possibility. Well, another thing to remember is the CSF's composition is not fixed. It varies with all kinds of events going on. So it goes up, it goes down, and there are many different substances that are there. And each person often has a different complex of these substances. So it's not a fixed variable. And a big problem we have is we try and look into this important modality. And I submit an important modality that's not getting enough attention is that we don't have data. So for instance, if we want to look at the data on, I don't know, 42-year-olds with drug addiction, I'll say that, what is their data going to be like as compared with a 19-year-old basketball player? So many different factors are there. And so if we can get a range of normal, that would be an important step forward in doing something. Well, I'm now going to talk about some of the facts that are with CSF. I'll go through a few of them. So it's not a constant, steady stream. It's not exclusively produced by the choroid plexus. The production changes with age. So a younger person, as far as we can tell, has a much greater CSF production than someone in my age cohort. The CSF production changes through the day. It goes up and down, and it's particularly influenced by the sleep-wake cycle, which turns out to be a big deal, which I'll talk about. As far as preserving mentation and late age, it would be good to sleep 7 hours a night. Something is avoided. I've avoided that. I don't sleep 7 hours a night, but that would be a good thing. The CSF flow can be altered with position. And the intracranial pressure is a variable substance. It goes up and down. And there is CSF flow compensation. Let's go through a few more. The flow, as I indicated earlier, is transient. It can go up and down depending on many factors. Sleep is a big deal because when you sleep, your metabolism drops. CSF flow can be a more effective modality, particularly to take out the detritus of brain metabolism. So getting a good night's sleep is a really important thing for brain health, in my opinion. And it clears these metabolites out. So one of the issues as far as dementia and old age, I think a disturbed sleep pattern is a part of it. This age, so CSF production diminishes with age, and it diminishes as it's a reciprocal of brain metabolism. So your brain is, at my age, my brain is far less active than the young people here, but it doesn't work as much. But so therefore, there's less CSF being produced there. That's, I think, an important issue with metabolic activity. Keep going. Body position can change your CSF production and in general how well it's working. And so if you sleep like this, you're generally going to have a better CSF circulation. And that body posture plays a big role. And this is sort of an example of what happens when you move your neck around. And I'm going to get into discussing this a little bit. This is where I think a choke point exists in CSF circulation. But movement of your neck can certainly alter your CSF production. Now, I'd like to put a little literary comment here. This is Edgar Allan Poe, who was an alcoholic. He died at an early age. He was tossed out of West Point, but he wrote a lot of interesting books. And this is one of his best known short stories, The Purloined Letter. So the story in this that Edgar Allan Poe discussed was there was a missing letter. Where is the missing letter? Did someone steal it? What happened? And it was just there all the time. And it was there, but everyone ignored it. And looking at brain aging, if I can look at that, here's some of the things that people know about over here. Alzheimer's plaques, Lewy bodies, cerebral vascular disease. And over here, this is what I'm going to talk about is chronic CSF circulation dysfunction. It's there the whole time, and it hasn't really been discussed too much. And we're going to undertake that, discussing a little bit. It's kind of a tree in the forest. Well, when you're looking at people, the idea is, well, they have some kind of CSF abnormality. Maybe that's playing a role in their psychological situation. And I think we can talk about that. Our idea, just simply put, is that as you age, in the neck, the size of the pathways for CSF to go down from the brain into the spinal cord are diminished. And our idea is maybe if that's the case, you could consider decompression of the cervical area under some circumstances. That's kind of our idea. And this is what we're going to talk about right here. These are things that are known about, that people say, well, there's some kind of problem. It needs to be treated, and we're going to do something about it. So you have acute hydrocephalus, normal pressure hydrocephalus, chronic hydrocephalus. And this is all taking place pretty acutely. But there's a cohort, a group of patients that have chronic CSF obstruction. It's there for a long time, and there's not really any substantial treatment underway because the pressure dynamics are not causing headaches particularly. What is happening is the brain is being damaged by the abnormal CSF circulation pattern. Okay, now this is a rather complicated slide. I won't get into it particularly, but this just shows what happens to different parts of the brain when there's a CSF circulation abnormality. So this happens, many different functions are impacted. And when they're impacted, these vicious cycles take place. So for instance, if the respiratory center of the brainstem doesn't work as well as it should, and we're getting sleep apnea, we're getting problems like that, when the PCO2 is changed in sleep apnea, then it injures other parts of the brain, and these injuries cascade. And that's one way to think about it. If we can prevent this cascade of different problems, then we'll preserve mentation. All right. Now, I'm now going to say, this is something that's not considered too much, is the role in CSF circulation that the vertebral column plays. So that's not really thought about much, but we can look at the amount of CSF that exists in the vertebral column. And there's a large amount there. We have a lot of CSF in the posterior fossa, and then that trickles down into the vertebral area. So we have 25 cc's there. That's a lot of CSF, and there's a circulation going on there. When the fluid goes from the brain into the vertebral column, it's absorbed there. So we have the arachnoid villi in the spinal cord. They suck up the CSF, and so if there is a blockage of some type there, and that circulation doesn't work, that's going to cause some increase upstream in the parenchyma of the brain. So this blockage that happens is bad. And this is what's, as a neurosurgeon, what I'm interested in a way, is that we have cervical spinal stenosis. And this happens as you age. There's a blockage that happens just normally. If you have neck pain or you can't move your neck as well, this is constricting the spinal cord and CSF production. So there's certainly an association between cervical stenosis and dementia and old age. Now, I said association, not necessarily a causal connection, but there's something going on. And this is what, as a neurosurgeon, we see. There's pressure up here in this. You can see the white substance is CSF. The dark, where there's a blockage, so the CSF is not circulating, and the spinal cord is undergoing some kind of injury. And so we focus on the injured spinal cord. What can we do? We're going to take pressure away. And the question is, what's going on with the brain upstream? And so that's an area that's been, I think, somewhat neglected. Let's see, this just shows, as you age, what happens with the development of stenosis in the neck. So everyone is getting older. Their neck is constricting. You're getting less room in your neck as osteoporosis and osseous changes happen. Right now, this just shows CSF obstruction and compromise. We can see in all kinds of experimental papers out there. And there's also additional evidence with other posterior fossa pathologies, particularly with when patients are iconoclastic. They're born with difficulties in their brain, and their chronographic dwarfs, and they have a substantial amount of neurological deficits referable to CSF circulation issues. Well, another thing to say is we have a handle in a way on CSF obstruction issues with doing cine MRI studies, and we can just show you a few of them. So this is what a normal study is going to look like, right on the extreme. The white, that's CSF around the spinal cord, and as constrictions take place, that area is diminished, and then findings take place as we go on, we finally get where there's a total blockage. When the total blockage takes place, we start to have substantial neurological symptoms. So that is a marker for what's happening with CSF flow. Now, one of the things that happens is a lot of compensation that occurs. When we do these tests, we can get an idea about the degree of compromise we can see how fast it takes the CSF to circulate there. So the CSF, as it's constricted, flows at a much faster rate. So we have an idea of what's going on. So assuming if CSF flow is episodically blocked by posterior fossa and cervical events, what would be the pathological events that would take place, which would lead to dementia? And so these are just some of what's going to happen here. There's going to be a direct tissue pressure, hydrostatic pressure on the substance of the brain, and it's going to be chronic and long-standing. So it's kind of like you have a rock in your shoe and it just stays there and stays there, and you sort of adjust to it, but your foot is injured by that. So hydrostatic pressure. The other issue is the choroid plexus is a two-way street, and if there's enough pressure alterations that take place, then the CSF or substances can go through the choroid plexus into the cerebral parenchyma. So it's a bad thing to have chronic, long-standing increased intracranial pressure. It also, we have clearance problems that take place, and sleep dynamics are altered. And then finally, we get tissue destruction. So one reason the brain is not as healthy and as big as it was when I was 21 years old, many reasons, but one of them is a bad cerebral situation with CSF clearance. Well, the pressure impact, just a few comments. I won't belabor this, but obviously if there's pressure there, we're going to have neurological damage. And when we have the diagnosis of Alzheimer's, which is a difficult diagnosis to take, it's kind of a clinical diagnosis. It really depends on biopsies, which or people are generally don't do for many reasons. And so we have to just get this diagnosis by the process of elimination. There's nothing else too much that's explaining why the person's intellectual facilities are diminishing. In any event, it's noted in Alzheimer's, the increased intracranial pressure will play a role in that. The choroid plexus I mentioned, just a quick little picture of that. Well, and the CSF circulation with the brain parenchyma. That's a big deal. So there are different ways that CSF is flowing in the brain. We have diffusion, bulk flow, active transport, and there's some filtration and secretion. The latter two are energy dependent. Now, this is kind of this slide really needs to be blown up a lot, but this just shows the necessity of CSF circulation in the brain. And anything that retards that process is going to have a negative neurological event. And the problem is that we don't have any way of really understanding what's happening in different people. How are you doing with your CSF circulation in your brain? Well, if it's abnormal, we might need to do something about it, but we don't have any effective markers for that. When we have these circulation changes, we can pick up abnormalities in the beta amyloid production there, and that we can get beta amyloid a little bit, finding it elsewhere, and the plaques increase when there are these changes. One of the general impact is secondary to clearance. It causes dementia. And so these are many things that are happening with increased CSF production or CSF pressure because of problems in the neck. Okay, we'll go a few more. So I mentioned sleep. So one of the things that's really important is sleep and CSF clearance. And so if you have, and we will discuss this later, some reason that the sleep-wake cycle has been disturbed in the brain, that has an additive effect of what's going on with its clearance issue. So if you don't have a good night's sleep, the clearance is diminished, and it's a cumulative effect. And this just shows some of the papers that exist making this point. And the sleep and metabolic brain activity. So if you're really awake and you're working hard and you're jumping around, then you're producing, if you want to look at it this way, more detritus in your brain. I can't sleep. I'm worried about the Georgia football team or whatever people worry about. And I just can't sleep. And my brain is working and it's metabolically active. And so the clearance arrangements are being impacted. So you could say that all that metabolic activity is going to produce more detritus, if you want to say it that way. And this is, there's a lot of evidence about people that fall into the Alzheimer's group, that sleep deprivation is present, pretty impressively so. Well, okay, so what happens finally after these events? Well, things equalize because there's cell death. We get a lot of cell death here. And so all of the pressure dynamics are altered. Well, we're getting this detritus problem where all the cells are dead. Therefore, there's less of a deal there. So the acute damage has taken place in the brain many years before, chronically and slowly with a number of processes. So and finally, people reach the stage of dementia. Well, the cow is out of the barn, so to speak. All of these events have already transpired, and we wind up with cerebral atrophy. And when all the cells die, the things get better, right? And so we get CSF compensation. Cell death is one of them. Click. When the brain, this happens in the brain, where would the impact take place? I don't have much time left. I'll race through it a little. So we can think of the brain as like an apartment house, and down at the bottom we have cervical stenosis, and so the CSF going up the different parts of the brain is substantially diminished, and that causes cell death and damage throughout the brain. And this is a complicated slide. It just makes the point that we get these vicious cycles that happen when CSF circulation is impaired. And that causes cell death, cell dysfunction in multiple places in the brain. And when that happens, we get vicious cycles. I don't have too much time left. Now, this is very complicated, so I'm racing through things that really require a lot more discussion. So I'll apologize for that. There's sort of ideas. This is what's going on in the brainstem when we have abnormal CSF circulation in the fourth ventricle. So that's a very key thing, and all kinds of things are happening. Blood pressure alterations, respiratory alterations, and that have an impact grossly on the body habitus, including the brain. And hunger regulation, if you have an issue with that, the apostat center can be impacted. Thus, you eat more, and as you get tubby, the respiratory situation diminishes, and a host of bad things happens. The circadian rhythm is disturbed. So the normal way that you can sleep, rest, whatever, that's another factor causing issues. This just shows different pictures. In this case, the ventricles are a little big as to transepenal absorption, what's going on, and there's where the white substances are. Generally, that demarcates some kind of cell injury. Another thing I won't get too much into, as the events take place, the tight junctions that are necessary to maintain the blood-brain barrier can be negatively impacted, and we get more cell damage. And we also have memory issues here. We have the temporal lobes are in the area of the fornix and memory, so there's an impact there. We can sort of see a quick picture of what's up. We have a memory impact. So finally, to therapy, which I'm almost finished, but I'll race through this. So there are different ways to deal with this. Again, body posture, shunning, drug suppression, different kinds of things, but surgery, being a surgeon, I think could be a useful way to do this. Going in and just decompressing where the tight place is can allow CSF to flow, and that could be part of the indications for operative intervention for cervical, particularly for cervical stenosis. It's not commonly discussed or known. One reason being that the damage that's taken place is chronic and long-standing, and you at best would reverse the progression of the disease. The other point is the brain plasticity is being what it is. It's hard to reverse a dead cell. I guess I'd say that's only so much we can do. And this would be the idea of what our objective would be. This is the cell death. Normal cell death is on the left line there. And if we did something to really help the circulation and it improved, there might be far out more cells alive after another decade. So that's the idea that you've done any good would generally take a long time to prove. And there are some papers saying there is positive impact. There are papers that say that. Shunning procedures have been employed because what we really need is to understand exactly all the nuances of CSF production, circulation. It's kind of a crude thing to do, I would say, as far as really restoring appropriate CSF levels. We can look at the beta amyloid levels after shunning. It looks like that makes it better. Drug suppression of CSF is often employed. Once again, it's kind of a crude thing to do because we don't know all the nuances of CSF circulation in the brain. So summary, degenerative cervical stenosis, it happens to us all. It's CSF alterations can take place from that. We get waste products built up in the brain damage. It could result in dementia. Better diagnostics are required. We could do a little more surgery. That's that busy slide that talks about all the secondary impacts. So what's needed? Well, I think what we need is some method to understand CSF dynamics. Maybe one of them would be to have a little transducer put in the CSF in the brain and then have communication back and forth. So you get the pressure dynamics or whatever is happening are recorded at a distance. And we could get some idea in each person how things are working. Well, that's an idea that's out there. Well, so the question is, what can we do? We need to understand the vagaries of CSF circulation. And I would say that when we are in medical school and we talk about all these things, I think there needs to be a little more attention to the subtleties of that process. Well, okay, thank you.